One of the things we always start our massage with, even within the massage to a new part of the body, is palpation. There's two reasons for that. One, it's giving me feedback as to how the tissue's feeling, where the work is needed. And two, more importantly, it's giving the client feedback. Because through your hands, they feel what's maybe tender, what's tight, what's hard, what's soft. And by them having that feedback, it provides a great opportunity for us to show the difference when we've finished our treatment. So palpation is your biggest selling point to your client because it will help them feel where they need the work, and two, the difference you've made when you've finished your massage. But now, palpation is not about poking and feeling. It needs to be therapeutic, and that's where using something like our simple compression work feels great to the client. You're already feeling what's going on in the tissue, but they're already releasing, they're already getting some desensitization because it is still therapeutic. So my posture doesn't change, it doesn't matter what my technique is, even with palpation, my power is coming from the back leg. And I'm just using the palm of my hands, pushing off the back leg to just do some gentle compression work and feel where this client needs work. I can use any applicator for this work, so changing to a soft fist or even down to a forearm. So compression, we're just pushing in and up and releasing. How does that tissue respond? How does it bounce back? Does it bounce back? Now, in terms of toweling to expose the leg, we want to do this in a swift motion. So I tend to expose the leg and then simply tuck it down to expose the whole of that leg. If someone's wearing shorts or boxer shorts that come quite a way down in the leg, then I'll often ask them to roll it up rather than me have to fuss around in that area. Because it's really important that we can massage the whole length of a muscle rather than just half of it if we want to get a good result. If you're using quite thick towels, then tucking can be quite uncomfortable. But if the towels are quite thin, it's quite a nice way to create a barrier for your client. So I'm just going to ask my client here, Danielle, can you tuck that and just pull your pants up to the top of the hip, please? Excellent. Now she's created a border she's comfortable with. It's exposed the whole length of the quads and I can do a better job. So just starting with some light effleurage. Note my posture, so nice soft circle with the arms, head and neck aligned, power coming from the back leg. So I start quite superficial, my strokes are quite fast, mostly spreading the lotion, warming up the tissue. It's quite clear that the lateral aspect of Danielle is much tighter than the inside. So I'm going to change my strokes to be slower, a little bit deeper, and I'm also going to change my applicator to the forearm. So note I've now dropped a little lower, and I'm still doing an effleurage. It's just a different applicator and a little bit slower, so it's going to feel a little bit deeper and a little bit more specific to Danielle. And coming back, and again, a slightly different line. So you don't want to iron over the same line of tissue again and again. You want to slightly change the angle, change the direction of your strokes, or it might become a bit irritating to the client. Lovely. Note, although I'm using my forearm, my wrist remains really relaxed, spine nice and aligned, power from the back leg. And finish right at the top of the hip, the whole length of that bow. I'm still doing effleurage, but now I want to also include the lower leg. So very different muscles here. If your client is quite rotated outwards, then really what you're left with here is the tibia. There's not much in the way of soft tissue to massage. So don't be afraid to simply just lift your client and rotate them so that you're exposing the soft tissues. The tibialis anterior in front of the tibia, the peroneals, and even the border with the calf can be worked from this position. So we're just going to do some nice effleurage, again assisted hands, power from the back leg. Now, if I want to continue my stroke up into the thigh, what I don't want to see is a bend and reach. So one, my pressure has completely changed. We want our pressure to be the same from the start of the stroke to the end. And two, just look at my back. So absolutely nothing's coming from that back leg. So now any pressure I apply is coming from that forward bend in a weak position, which means that it's going to affect my mechanics and my pain levels as a therapist. So a general rule is that your stroke will last as far as your knee to your toes. At that point, most of us don't have the mobility to go comfortably and strongly past that. We simply take a step and shuffle. So my first step, my stroke will end at my foot, which is the knee. I will then shuffle, foot at the hip. I have enough room to complete that stroke. And it will feel fluid and dynamic to your client. So coming up, one stroke of effleurage, I reach my end point. I'm just going to shuffle and finish the stroke into the quads. Lovely. So this area is quite small. If your client suffers from shin splints, some tightness in that tib and at the tibia, then a smaller applicator like a thumb might be more appropriate. But as we said in the general video, when you're using your thumb, your fingers, it's important that you assist it. So this hand is going to remain completely relaxed, completely passive. And this hand on top is the hand through which the pressure from my back leg will translate through to the tissue. So now assisting that thumb, head up, power from the back leg, I'm just slowly moving up through that tissue. Again, I'm a little bit more specific here, so my stroke is slower and therefore a little bit deeper to the client. Slightly different angle, working through that tissue. Power is coming from the back leg. Just look at my heel lift as I move forward through the tissue. No pressure over the knee, so we never want to put pressure through or on top of a joint. So we come lightly over the knee and then we re-establish our pressure into the soft tissue. Again, if someone is tighter around the tendons of the knee, we might use an assisted finger, assisted thumb to do a little bit more specific work in that area. Petrissage. So again, this can be done from the same side or from across the bed. I would generally do it same side on the leg, but it's easier for you to see if I work across the body. So, petrissage, slightly different than effleurage. So it's a deeper stroke and it's more about picking up tissue and separating tissue. So what I don't want to see, and what you often see when people use the arms rather than the hips, is that it becomes simply quite a superficial effleurage, but just in a transverse direction. Whereas what we want to see here, and what we want to create, is a pump effect between the tissue. So you want to use your hip to pick up that tissue, and as you can see, that tissue then squeezes between my hands, creating that pump effect, which helps increase local circulation. From hip to hip, my weight is just transferring from one side to the other, head and neck nice and aligned. So that's wringing. So we're wringing that tissue between the hands. Note my thumb. It's with my hand, so it's passive. What I don't want to see and what the temptation is here is to separate that thumb and to use the thumb to pick up the tissue. One, it doesn't feel very nice to the client, but two, that is a lot of pressure to put through a very weak joint. So keep the thumb as part of the hands and simply pick up that tissue in a nice wringing action. Again, changing the area, so here working through vastus lateralis, IT band, into the back of the hamstring even. And as I come round on top, more into vastus intermedius, rectus femoris, and even into the inside of the adductors and vastus medialis. We can swap our stroke to be kneading, which is more of a figure of 8 side to side motion, a little bit more superficial and more appropriate in places like the back. But actually, if your client isn't very muscular, it can be quite good in this area too. As you can see, I'm traveling. It's simply becoming a shuffle of my feet. Okay? What I don't want to see is a reach and twist, because that twist in the body will create problems for your back. So you just want to shuffle along as you work through the client's tissues. And again, just wringing the tissues. Here we're into the calf, border with soleus, peroneals and the tibant. Another nice way to do some compression work is to simply sit back into your squat and just compressing that border of the vastus lateralis and the IT band. And then I'm going to simply return to Effleurage because it's a really nice finishing stroke. Again, direction, I'm here working towards the heart, but it can be in any direction. Some transverse strokes can be really lovely, getting some separation through those 4 muscles of the quad. But again, all movement is coming from the back leg. In terms of the feet, we can bring effleurage to this part of the body as well. We simply start our stroke lower. What we don't want to do is to be bending the foot and putting excess pressure through that ankle joint. So it's just really important that when working through the foot that we're conscious of that joint and we're supporting it. So even working just down the inside arch of the foot, it's to make sure that you're not bending the foot down, you're keeping the ankle neutral. And again, my back heel is lifting as I work through that tissue at the sole of the foot. Okay, soft fist is really, really nice through here. Using one hand to support, because what I don't want to do is force that joint. This hand is simply helping to keep the ankle neutral, and it also helps provide a little bit of resistance to me. And then with a soft fist, lifting my back heel, and just doing some nice slow strokes through the foot. How's that pressure for you?
Really good.
Again, rotating the leg. If I want to come into the inside of the leg, into the adductors a little bit more, or into those medial calves and soleus, then just rotating the client's leg out opens up all of that soft tissue. I'm going to demonstrate some petrissage to you into those adductors. Again, you won't see the tissue, but I just want you to note the movement of my hips so that you can see how I'm transferring the weight and keeping a neutral spine. Just picking up that tissue, thumb is with hand, and I'm just transferring weight from one side to the other. And when you've finished your general massage to the legs, as I said, your best selling tool, palpate. It's going to feel really nice, just a little bit of compression work, and your client is hopefully getting messages saying, "Ooh, that feels nice, that feels better." And they can definitely see that you've made a difference. So now I'm going to turn my client and we're going to work on the posterior leg. So first thing we need to think about is health and safety. So it's making sure that we remove the pillows before we turn the client. Because if we leave them there and the client tries to turn, they get in the way, there's more of a chance that your client might trip over them or fall off the bed. So I'm going to remove the pillow from under the knees first. Just raise your knees, thank you. Really important that you put your pillow on a chair or a clean surface. We don't want to put it on the floor where it can pick up germs, hairs and bacteria. Then I'm going to pick up the head pillow, thank you very much. And I'm going to use the pinning the towel technique to turn Danielle today. So I'm just going to pin my legs against the towel in the bed, lifting up the other end, and then simply ask your client to rotate towards you. And towel down. Once your client's appropriately toweled, you just need to remember to place the pillows back where they're needed for support, which in this case, when we're in prone, face down, is under the ankles to stop that pressure and that plantar flexion of the ankle. And then we're ready to work on the posterior. I've turned my client, but I still want to start my techniques here with some palpation. So I'm going to do some nice compression work into the posterior legs. One in particular I love to work through is the glutes and those deep hip rotators, as it's often an area where people are quite tight and it's a really nice place for them to feel what's going on before we do any deeper, more specific work. So a supported fist, or if you have a strong wrist, even unsupported fist is really nice into that area. So lifting that back heel, compressing the tissue. Lifting that tissue up and away from the bone. This is not about crushing tissue into bone, it's about teasing it up and away. Elbow, fabulous in here. So a nice soft elbow. I'm not looking for a strong tight fist and a pointed elbow. Soft elbow, relaxed wrist makes a huge difference. Connecting with that tissue, and then I'm just teasing it away from the bone. Listening to the tissue. Where does it need work? Definitely some tightness in the deeper tissues here with the client. So I'm making a note that, yep, we definitely want to do some work into the hips. Feeling that down through the leg, again a nice soft fist. Hamstrings feeling good with that lateral quad still quite tight. And just dropping to a forearm. And what you'll notice is I've lost 6-7 inches in height, but I'm not bending over to connect with the client. I'm simply widening my lunge. So I can keep a nice posture and keep aligned as I work through the client's tissues. Keep a nice soft wrist, nice and relaxed. So I'm just separating the client's legs a little because she has them quite tight together, which will be hard for me to access those medial tissues, but also just for toweling. And then just going to separate the towel and then just tuck to create my border. Again, if your client's wearing shorts, you can just ask them to roll them up for you. So let's start with just some basic effleurage using the hands as an applicator. Soft circle with the hands, head up, shuffling to work through the whole length of the tissue. Shuffling back, knees at knee. So I'm going to run out of space No pressure behind the knee, so same principle as the front of the knee. We never want to put pressure through a joint. We simply lighten up on the pressure, glide over the back of the knee, and then re-establish our connection and our pressure in the upper part of the leg, into those hamstrings. Lovely. So I'm finding some tightness, and that might take some time for you to develop, but I'm just going to change my applicator, and here I'm going to drop down to a forearm, and maybe slightly onto an elbow to help me come up those hamstrings towards the attachments at the hip. I can simply rotate my body now to rotate onto my elbow and just pause, doing some compressions at the top of the tissue. And again, just working through those hamstrings, coming back, lift the back heel, nice relaxed hands, and coming up and rotating through the tissue. So petrissage, a lovely technique, so I'm already thinking petrissage would be nice through these calves. But first of all, again, that lateral tightness really follows down and into her lateral calf as well. So that lateral muscle belly of the gastrocnemius. So I'm going to use an assisted thumb to allow me to get a little bit more specific in there. So passive relaxed thumb, pressure through the hand on top, and raising that back heel as I slowly move through the tissue. I'm actually going to change my direction now to work transversely to try and get some separation between those layers of tissue. So I'm probably working through an inch of tissue here, but again it's coming from that back heel as I lift up and just try and get some separation through those lateral fibers. And let's do some petrissage. So some ringing is nice through here. All of the actions coming from the hips, translating weight from side to side. And again, just shuffling along to work up into the hamstrings and into that lateral leg. Keep the hands relaxed. When I tend to see this action where the fingers are straight and sticking off the client, not in contact with the client, that says to me that you're trying to create pressure and tension through your hands. If your hands are relaxed, they should stay in contact with the client through the whole of the stroke. Also, bright red hands is a big giveaway, so try and keep them relaxed and it'll feel much nicer for your client, but it'll also help you palpate the tissues better. And once you've finished your general massage through that area, remember to simply palpate the tissues, giving you an indication of the work you've done and also ensuring your client feels the difference in the tissue. Lower applicator, wider lunge. So if your client's calves, for example, are really hypertonic, you're not really getting anywhere with your effleurage, then maybe trying some vibrations is another technique to help switch off, downtrain those fibers. Okay? So what we don't want here is vibration that's going to make the foot flop around, put pressure through the ankle and having unsupported joints. So by having our hand on top, supporting the heel and the foot, we can help minimize any excessive movement through that joint. And then just adding a little bit of vibration through the muscle. So this is a really general vibration to the whole of the calf group and the whole of the lower leg. Again, if you want to do it more locally, we can take the leg down and then simply add a little bit of vibration locally with our hands. Again, we don't want the leg to be rolling, we don't want excessive movement through the knee or the ankle. So make sure that you support the leg well, maybe use one hand to support, and with the other hand add some vibrations through the tissues. And then try our effleurage again.